Longitudinal is simply collecting things over time, collecting data over time. We can measure the genome a single time, and typically in scientific studies we've referred to that as a cross-sectional study. But if you're measuring something longitudinally, that means you're going to measure it more than once. And so if you think about your own health record, for example, you go into the doctor, hopefully you've been to the doctor more than once in your lifetime, and you have your electronic health record built up, and you get these blood tests. If your doctor has your health record and there's other entries in there, he or she is able to compare today's results with the results from last year with 5 years ago and start to determine, are you deviating from whatever your normal trajectory is, or maybe it's a good trajectory that you're deviating toward, or maybe it's a bad one. Health itself is dynamic. So the longitudinal aspect, where we measure things over time, is absolutely crucial to measure a system that is changing over time. If you just took a single data point, even if you measured everything, given that there is a lot about me that is constantly changing, how could you possibly hope to personalize any sort of therapeutic or treatment for whatever it is I'm currently going through? So if you just have a completely static system, something that doesn't change, like the genome for the most part, we can measure that once, and we aren't necessarily losing any information if we only measure it the once. But instead, if we have a system that maybe can have two different states, it can either exist in state A or state B, and it will vary over time. Maybe we know why, maybe we don't. We kind of need to be able to measure it more than once in order to understand what state is it currently in. Is it in A right now? At what point has it shifted over to state B? And as we do that more and more, we can start to learn, what is that transition? Are there certain characteristics that precede the transition? And if we're talking about disease from health state A to health state B, the more we collect those data over time, the better chance we have at not just understanding when and being able to predict that a transition will happen, but ideally, we might be able to understand why it's happening such that we can prevent it.